What if I told you that your penis could be warning you about serious health issues, years before your heart does? Most men over 60 start noticing changes down there, but they don't talk about it. They assume it's just part of getting older. And by the time they do bring it up, it's often too late to catch the bigger issue underneath. I'm Dr. Justin Keller, a urologist, and in this video, I'm going to walk you through the real changes that happen to a man's body after 50, especially the ones no one ever warned you about. We'll talk about why your erections might not be the same anymore, how aging affects size and sensitivity, and what daily habits could be making it worse. I'll also show you the foods and supplements that actually help, and the truth about intimacy after 60, how it changes, and how it can actually get better. Stick with me until the end, because the first habit I'll cover is one of the most surprising, and it's something almost every man does every day without knowing it's causing harm. Leave your city in the comments. I want to know where you're watching from. Let's build a space where older men can finally talk about the things that matter. And if you find this helpful, please like this video and subscribe to Glowing Age. That helps me keep bringing you clear, honest, and practical advice that actually makes a difference. Now let's get started. What no one tells you about aging and sexual health. Did you know your penis could be one of the first places to show signs of aging, even before your heart or joints give you trouble? Most men don't. And by the time they notice something's changed, they're already asking, is this normal or is something wrong? I'm Dr. Justin Keller, a urologist, and I'll tell you something straight. What happens to the penis as we age is not just about sex. It's about your overall health. Your circulation, your hormones, your nervous system. This part of the body is deeply connected to them all. But no one prepares you for that. No one tells you that a softer erection or a slower response might be your body's way of whispering, "Pay attention." Let's break this down. First, blood flow. The penis relies on strong, consistent blood flow to function properly. As you age, the blood vessels naturally lose some of their elasticity. That means they don't expand as easily and blood doesn't flow as freely. It's not about desire, it's about hydraulics. Many men think they've lost their drive. In reality, their blood vessels are simply aging just like the rest of the body. Second, nerves. Just like vision or hearing, nerve sensitivity diminishes with age. That means it might take more stimulation to achieve the same level of arousal or sensation. You're not imagining it, it's a neurological fact. And it's completely normal. Then there's testosterone. From your 30s onward, levels begin to decline gradually. By 60 or 70, that decline can become more noticeable. Testosterone affects everything from libido to muscle mass to mood. But here's the twist. Low testosterone often gets blamed for everything. In truth, it's rarely the only factor. Often, it's one piece of a more complex puzzle that includes stress, poor sleep, medications, even loneliness. And this brings me to a hard truth. Aging doesn't just affect function, it affects how men feel about themselves. I've seen proud, confident men begin to question their worth because they can't perform the same way they did at 40. That's heartbreaking because the truth is, aging changes your body. But it doesn't take away your value or your capacity for intimacy. Let's also talk identity. For many men, the penis is tied to masculinity and pride. So when changes happen, whether that's size, firmness, or frequency, it's easy to feel like something is being taken away. But that mindset is part of the problem. Aging doesn't have to mean loss. It can mean evolution, if you understand what's happening and why. You see, sexual health in your 60s and beyond is less about performance and more about connection, health, and self-awareness. It's about understanding your body as it changes, adapting, and getting the right support. Here's something most men never hear. The penis is like a thermometer for your vascular and metabolic health. Erectile changes can be an early warning for high blood pressure, diabetes, or heart disease. So if you notice differences, don't ignore them. Don't chalk them up to just getting older. Sometimes, those early signs can save your life, literally. The good news, there are options, many, but the first step is understanding what's going on. The second is knowing you're not alone and that it's not your fault. You're not broken, you're aging, and with the right care, aging well. The most overlooked changes that start after 50. One of the most common things I hear from men in their 60s is, "Doc, I didn't expect this." They're not talking about illness or disease. They're talking about subtle, often silent changes that started years ago, changes no one warned them about. Let's start with something that catches many men off guard: shrinkage. Yes, actual reduction in size. I'm not talking about dramatic change, but noticeable. Over time, the penis can lose a bit of length and girth. Why? Several reasons. First, as testosterone declines, the tissues lose elasticity and tone. Second, fat accumulates in the lower abdomen, creating a buried penis effect. Even if the penis itself hasn't shrunk much, the fat pad can make it look like it has. It's an optical illusion, but it has a very real psychological impact. Then there's erectile rigidity. What used to be automatic now takes time. Erections may not be as firm, or they may not last as long. You might need more stimulation or more time between erections. What's happening is a combination of decreased blood flow, reduced nitric oxide in the vessels, and changes in smooth muscle tone. This is not failure. This is physiology, and yet most men panic when it happens, thinking it means the end of their sexual life. It doesn't. Another overlooked change is sensitivity, or rather, the loss of it. The glands, or head of the penis, can become less responsive with age. That's because the sensory nerves become less efficient over time. It might take longer to become aroused or reach climax. And when you do, the sensation may not feel as intense as it once did. That can feel disappointing, even confusing, especially if your desire is still intact. But again, this is normal. Not necessarily inevitable, but common. Let's talk about orgasm itself. Many men report that their orgasms are shorter or less intense as they get older. Ejaculation may not be as forceful, volume may decrease, and recovery time, the time between erections, increases significantly. This is called the refractory period, and in your 20s it might be minutes. In your 60s or 70s it can be hours, sometimes even a day or two. This is entirely normal. In fact, a longer refractory period is one of the most predictable signs of aging in male sexual health. Some men also notice penile curvature developing, a condition called Peyronie's disease. This happens when fibrous scar tissue forms inside the penis, causing it to bend during an erection. It can be mild or more pronounced, and while it's not always painful, it can interfere with sexual activity. Again, it's common after 50, especially in men with diabetes or vascular issues, but it's often ignored or left untreated due to embarrassment. Then there's the skin. Yes, even the skin changes. Over time, the penile skin can become thinner, drier, and less elastic. Some men notice discoloration or tiny broken blood vessels. Others develop what's called lichen sclerosis, a skin condition that causes white patches or scarring. While these changes are usually harmless, they can affect confidence and comfort. Now you might be thinking, why didn't anyone tell me all this? And that's the point. Most men were never taught what aging really looks like when it comes to sexual health. These aren't topics we were raised to talk about. Not with our fathers, not with our doctors, and certainly not with our friends. But ignoring these changes doesn't make them go away. Understanding them, though, that's where power begins. When you recognize what's normal, you stop blaming yourself. And when you know what to look for, you can take action, whether that means making lifestyle changes, getting medical support, or simply accepting your body as it is today. Aging doesn't mean decline, it means change. And the more informed you are, the better you can adapt, respond, and thrive. What doctors really want you to know, but don't always say. Here's the truth: most doctors aren't trained, or don't have the time to have honest, detailed conversations about what really happens to men's sexual health after 60. Even in my own medical training, we were taught about diseases and dysfunctions, not about how aging quietly shifts a man's relationship with his body, his identity, and his sense of connection. But I'll tell you now what I tell my own patients, frankly, without sugarcoating. Let's start with testosterone. Yes, it declines with age, slowly, steadily. But the myth is that low testosterone is the only reason for reduced sexual desire or performance. That's not true. Most men still produce enough testosterone to function well into their 70s and 80s. What's more important is how your body uses it. Chronic stress, poor sleep, weight gain, and inflammation blunt testosterone's effect. In other words, it's not just the number on the lab test, it's what's happening around it. Then there's sleep, one of the most underestimated drivers of sexual health. Men who sleep poorly often experience reduced testosterone, increased cortisol, and higher rates of erectile dysfunction. A study from the University of Chicago found that even 1 week of sleep deprivation can drop testosterone levels by up to 15%. That's the equivalent of aging 10-15 years, hormonally, in just days. If you're snoring, waking frequently, or always tired, get it checked. It's not just about rest, it's about hormones, recovery, and libido. Let's talk weight, particularly belly fat. Fat cells, especially around the midsection, convert testosterone into estrogen. That hormonal shift can quietly chip away at desire, energy, and even confidence. I see men who say, "I just don't feel like myself anymore." Often, shedding even 10-15 pounds reverses that dramatically. This isn't about vanity, it's about biochemistry. Now here's something many doctors hesitate to say. Mental health matters more than we admit. Anxiety, depression, past trauma, and isolation, all of these take a heavy toll on your sexual self. If you feel distant from your partner, withdrawn from intimacy, or emotionally flat, it's not just aging. Mental well-being is tightly linked to sexual function. You can't separate the two. A man who doesn't feel connected, purposeful, or supported will struggle in the bedroom, no matter how good his blood flow is. Another important issue: medications. Blood pressure drugs, antidepressants, even prostate medications can quietly dampen libido or impair erections. But most men never bring it up, and most doctors don't ask. You don't have to suffer in silence. If your medication is affecting your intimacy, speak up. In many cases, there are alternatives. Finally, we need to talk about the prostate. Whether it's benign enlargement or prostate cancer treatment, any intervention around the prostate can alter erections, sensation, and even ejaculation. This is a conversation too few men have until after the fact, when they're confused or grieving what they've lost. I always urge men, if you're facing prostate issues, get clarity on the sexual side effects before treatment, not after. Knowledge equals options. Here's what I want you to remember. Aging brings change, not failure. The changes happening to your body aren't a punishment, and they're not a moral weakness. They're physiology. And they're manageable. If you speak up, if you stay informed, and if you treat your body like it still matters. You don't stop being a man because your body slows down. You stop feeling like a man when you start believing you have nothing left to offer. And that's simply not true. Your health, your pleasure, your intimacy, they're still yours. Don't let silence take them from you. Daily habits that hurt or help. Penile health. Most men don't realize how much their everyday habits are either quietly protecting their sexual health or slowly damaging it. Not dramatic things, not medical emergencies. Just small choices repeated day after day, year after year. And the penis, being dependent on blood flow, nerve health, and hormones, is one of the first places those habits show up. Let's talk about the habits that hurt first. Smoking is one of the worst offenders. I'm not just talking about your lungs or your heart. Smoking directly damages the inner lining of blood vessels, including those that supply the penis. It leads to plaque buildup, reduces nitric oxide, which helps with erections, and accelerates the narrowing of arteries. I've seen men quit smoking and within months notice a clear improvement in their erectile function. That's how direct the connection is. Alcohol is another quiet saboteur. A drink here or there is fine, but regular, heavy drinking affects testosterone, disrupts sleep, and dulls nerve sensitivity. It may help you relax in the moment, but over time, it numbs the very system you rely on for desire and response. Plus, alcohol is a depressant. It lowers mood, energy, and motivation. A dangerous combination. Sitting too long, especially in today's world of screens and recliners, is a modern problem with old consequences. When you sit for hours a day, especially with poor posture, it compresses the pelvic region. Blood flow decreases. Nerve pressure builds. Muscles weaken. Over time, this leads to reduced circulation to the genitals, lower back and hip pain, and weaker erections. A sedentary lifestyle is an erection killer, plain and simple. Now, here's the good news. Just as daily habits can harm, they can also heal. Walking. Yes, something as simple as walking 30 minutes a day has been shown in multiple studies to improve erectile function, reduce stress, improve sleep, and boost testosterone. It's low-impact, heart-friendly, and improves blood flow across the board, including to the penis. If walking was a pill, every man would take it. Pelvic floor exercises, often overlooked, are incredibly effective. These are the same Kegel exercises often recommended to women, but men benefit just as much. Strengthening the pelvic floor improves control, firmness, and even climax quality. You don't need a gym, just awareness and consistency. Contract the muscles you'd use to stop urinating midstream. Hold for 5 seconds, release, repeat. Simple, proven, hydration matters more than you'd expect. Dehydration thickens the blood, reduces circulation, and impairs energy and focus. Staying well hydrated helps maintain optimal blood volume and supports healthy blood pressure, both essential for erectile health. Stress management is critical. Chronic stress floods your system with cortisol, a hormone that suppresses testosterone and constricts blood vessels. That's why men under constant pressure, financial, family, or health, often report lower libido and weaker erections. It's not in your head, it's in your chemistry. Deep breathing, walking, time in nature, journaling, whatever helps you decompress, it's not a luxury, it's medicine. Lastly, sleep. If you're not sleeping well, your body can't repair, regulate hormones, or maintain a healthy libido. Most testosterone is produced during deep sleep. Poor sleep, low testosterone no matter your age. If you're waking up unrested, snoring, or tossing all night, it's worth getting evaluated for sleep apnea or other disturbances. Your health and your sex life depends on it. What I want you to take away is this. It's not always about the pills or the treatments. Often it's about the basics done consistently. Movement, rest, hydration, oxygen. These are the real foundations of male vitality. You don't need to overhaul your life. But you do need to pay attention. Because every habit either feeds your sexual health or starves it. And the beauty of the body, especially at this stage in life, is that it can still respond. Even small changes made today can bring back clarity, confidence, and connection tomorrow. Foods and supplements that actually make a difference. I often tell my patients, if you want better erections, start by fixing your dinner plate. Nutrition is not just about your heart or waistline, it directly impacts sexual function. The penis is a vascular organ, which means blood flow is everything. And what you eat determines how well your blood flows, how balanced your hormones stay, and how resilient your nerves remain. Let's begin with the basics. Heart-healthy foods are penis-healthy foods. If it's good for your arteries, it's good for your erections. And the reverse is true too. Clogged arteries don't just lead to heart attacks, they lead to erectile dysfunction. In fact, ED is often an early warning sign of cardiovascular disease, showing up years before other symptoms. So what should you eat? Start with leafy greens like spinach, kale, and arugula. These are rich in nitrates, which your body converts into nitric oxide. Nitric oxide is the molecule that opens up blood vessels, allowing blood to flow more easily. Without it, erections become weaker or more difficult to maintain. Beets are another excellent source of dietary nitrates. They help dilate blood vessels, reduce blood pressure, and improve stamina. Several small studies have shown that beet juice can even enhance exercise performance, another plus for vitality and blood flow. Then there are berries, especially blueberries and strawberries. They contain flavonoids that have been linked to a lower risk of erectile dysfunction. One study from Harvard followed over 25,000 men and found that those who consumed the most flavonoid-rich foods had significantly lower rates of ED. Fatty fish like salmon, sardines, and mackerel are loaded with omega-3 fatty acids. These reduce inflammation, improve circulation, and support healthy cholesterol levels. Omega-3s also play a role in testosterone production, especially in aging men. Don't overlook nuts and seeds either. Walnuts, almonds, and pumpkin seeds are high in healthy fats, magnesium, and zinc, 3 nutrients essential for sexual health. Zinc, in particular, is critical for testosterone synthesis. A deficiency, which is more common with age, can lead to low libido and fatigue. And let's not forget dark chocolate, in moderation. The flavonoids in cocoa help improve blood vessel function and increase nitric oxide. Just make sure it's high-quality dark chocolate with minimal added sugar. Now, what about supplements? There's a lot of marketing hype out there, and not every supplement lives up to its promise. But some do have strong evidence behind them, especially when used alongside good nutrition and lifestyle habits. L-arginine is an amino acid that helps produce nitric oxide. It's often used to support blood flow and has been studied for its potential to improve mild to moderate ED. On its own, results are modest, but when combined with pycnogenol, a pine bark extract, some clinical trials show real benefit. Zinc is crucial for testosterone production, immune function, and sperm health. Older men are often deficient due to reduced absorption. A daily supplement of 15–30 mg may help, but always check with your doctor before starting, as too much zinc can cause problems. Magnesium is another underrated mineral. It supports testosterone production, improves sleep quality, and reduces inflammation. Many men, especially those on certain medications or with digestive issues, are low in magnesium. A daily supplement of magnesium glycinate or citrate can be effective. Vitamin D plays a role in hormone regulation. Low levels are linked to low testosterone and decreased sexual desire. If you don't get regular sun exposure, you may benefit from 1,000–2,000 IU daily. Ashwagandha, an adaptogenic herb, has shown promising results in small studies for boosting testosterone and reducing stress. While more research is needed, it's generally well tolerated and can be helpful, especially for men dealing with fatigue or anxiety. And then there's Panax ginseng, sometimes called herbal Viagra. Some studies support its use for improving erection quality and overall sexual satisfaction, but quality and dosage matter. Always choose a reputable brand and don't expect miracles overnight. That said, no supplement can outwork a poor diet or an unhealthy lifestyle. Think of them as tools, not fixes. They support, but they don't replace the foundation. My final advice: avoid extreme diets, processed foods, and excess sugar. These create inflammation, disrupt hormones, and damage the delicate blood vessels your sexual health depends on. Food is fuel, but at your age, it's also medicine. And every bite is either helping you stay vibrant or slowly moving you further from where you want to be. Choose wisely. Your body and your future are listening. Intimacy after 60, a new chapter, not a closed book. For many men, intimacy after 60 becomes more complicated, not just physically, but emotionally. And yet, this is also the stage of life when intimacy can become deeper, more meaningful, and even more satisfying, if you're willing to reframe what it means. Let me tell you something I've learned from listening to hundreds of men over the years. The biggest struggle isn't the loss of erections, it's the loss of confidence. When your body starts responding differently, it's easy to feel like less of a man. You may not say it out loud, but inside there's a quiet shame. A fear that you're no longer enough for your partner, that you've become invisible or replaceable. But here's what I want you to understand. Intimacy is not just about performance. It never was. It's about connection, presence, and emotional trust. And those things, if you allow them, only deepen with age. You don't need to chase the kind of sex you had at 25 to have a fulfilling, intimate life now. In fact, many couples find that when the pressure for performance fades, they rediscover a level of emotional closeness they haven't felt in years. They slow down, they explore, they communicate. They touch, not with urgency, but with intention. This is where a lot of men get stuck. They've been conditioned to think that intimacy begins and ends with an erection. And when that becomes less predictable, they feel broken. But the truth is, there's a broader landscape of pleasure and connection waiting if you're open to it. Communication is key. If you're partnered, talk to your spouse or partner openly. Not just about what's not working, but about what you still want. What feels good? What's changed? What you miss? Vulnerability may feel foreign at first, but it's the doorway to deeper intimacy. And if you're not partnered, don't assume that aging has closed the door on connection. Many people find love and companionship later in life. And when they do, it's often more emotionally rich than anything they knew when they were younger. Let's also talk about touch. Touch is powerful, and it doesn't have to lead to intercourse. Holding hands, a hand on the back, lying next to someone and simply being seen, being present, that is intimacy. And for many people in their 60s, 70s, and beyond, these moments become far more valuable than any physical act alone. I've had patients in their 80s tell me that they feel more connected to their partner now than they did at 40. Why? Because they stopped trying to perform and started trying to connect. They found a rhythm that honored their changing bodies without giving up on closeness. Now, let's be clear, this doesn't mean giving up on sexual health. If there are medical issues interfering with function, talk to your doctor. There are effective, evidence-based treatments available, and you deserve to feel good in your body. But what I'm saying is, don't let physical changes become emotional walls. Don't let silence take over. You are still worthy of touch, of pleasure, of connection, no matter what's changed physically. And if you've been through loss, if you've lost a spouse or a long-term partner, I know this chapter can feel confusing or even painful. Grief changes everything, but don't let it tell you that you're done. You may be in a new season of life, but that season still holds beauty, still holds the possibility of warmth, laughter, and affection. I'll leave you with this. Your capacity for intimacy does not fade with age. It matures, it deepens, and it takes on new meaning. Yes, the body changes, but the heart still knows how to love, to touch, to connect. That's not something you grow out of, that's something you grow into. You've just heard the truth about how aging affects the penis, and more importantly, what you can do about it. Remember, these changes aren't your fault. They're not a sign of weakness. They're your body's way of telling you it's time to pay attention. Small changes in your daily habits, your food, your movement, they really can make a difference. And if you've ever felt like you were the only one going through this, you're not. Thousands of men are facing the same things. The difference is, now you know what to do about it. If this video helped you, please like it and subscribe to Glowing Age. That support means a lot, and it helps me continue to create honest, useful content for men who deserve answers, not silence. And don't forget, drop your city in the comments. Let's show the world that men over 60 are still learning, still growing, and still in the game. Take care of yourself. You matter more than you know.